One of the most common conditions that I see in my practice as a neurosurgeon is something called lumbar stenosis. And lumbar stenosis is basically narrowing of the spinal canal in the lower back. And in that spinal canal, there's a bunch of nerves that traverse down, they go through the spinal canal and then they go down to your legs. And as that spinal canal narrows, which is what stenosis is, it pinches those nerve roots. And so what happens in patients with lumbar stenosis is they realize that they have to lean forward in order to use their legs or to not have pain down their legs. Because as soon as they stand up, they get pain and weakness in their legs. So oftentimes these patients will say, I can only walk if I'm leaning over on a shopping cart. And the reason for that is there is this ligament in the lumbar spine called ligamentum flavum. We also call it yellow ligament. And it has a bunch of elastic fibers in it. So it's very stretchable and it bunches up when it's not under tension. So when you lean forward, it stretches that yellow ligament out, and that yellow ligament basically thins out and takes up less room in the lumbar spinal canal. And so your nerves don't get pinched when you're leaning forward. As soon as you stand back up straight, that yellow ligament contracts, bunches up, and takes up room in the spinal canal and pinches your nerve roots. So that's a very common condition. And the amazing thing about lumbar stenosis is that it responds amazingly well to a procedure called lumbar laminectomy. So we go and we remove parts of the bone above the nerves, which makes room, and we remove that yellow ligament, and it makes room for these nerve roots. So now you can stand up and walk, and you don't get pain in your legs or weakness in your legs when you stand up. And it's very satisfying to see. I'll take patients to surgery, and they'll be totally hunched over and in so much pain, and they don't have any mobility anymore because of this severe stenosis. I'll do a laminectomy, and after surgery, even though they have incisional pain, they're standing straight up and they're so happy they can use their legs. It's very satisfying to see. So this is what I do in my career as a neurosurgeon. But also, I have a podcast. It's called the Dr. Kumar Discovery, and I talk about health and wellness. I explain complex topics clearly, and I do it all just to put good, clear information out into the world. I hope you can check it out. It's called the Dr. Kumar Discovery Podcast. You can find it on any major podcast platform, and I'll see you there. Cheers.